Myself Pavithra D L, Assistant Professor, Department of Medical Laboratory Technology, Yenepoya School of Allied Health Sciences. My topic is ABO blood grouping techniques. So we will see what are the specific learning objectives of this topic. At the end of the session, students should be able to name the different blood group system, describe the different techniques, methods and interpretation of blood grouping, able to list out the advantages and disadvantages of different blood grouping methods. We will move on to the introduction. So this ABO blood grouping system was discovered by Karl Landsteiners in the year 1900 to 1901. So we have 4 different blood groups which are called as the major blood groups, which are namely A, B, AB and O. So in the year 1902, later he discovered AB blood group system with his associates Von De Castillo and Sturley. So for this work he awarded Nobel Prize for his work. So next move on to the Landsteiners law. So this ABO blood grouping system mainly depends upon the Landsteiners law, where we can see the relationship between antigen and antibody. So individual who lacks the antigen of ABO system will have a corresponding antibody in their serum, which means if an antigen is present in the patient's blood cell, the corresponding antibody will be absent in the patient's serum or a plasma under the normal conditions. So we will see what are the ABO blood grouping techniques. There are 2 blood group techniques which is available or used. First one is a forward grouping, second one is a reverse grouping. So for forward grouping, here we are using patient's blood, which is RBC. In that we will find out the unknown antigens. So the unknown antigens which is present in the red blood cell suspension, which is made to react with the known antibodies in the antisera to give an visible agglutinations. So in reverse grouping, we are using patient's plasma or serum. So here unknown antibodies present in the serum or a plasma is made to react with antigen present in the pooled cell, which gives an visible agglutination. Let's move on to the grouping methods. So we have 5 blood grouping methods. First one is slide or tile method, second is a tube method, third is a microplate method, fourth is a microtyping method and fifth one is a automated or a semi-automated method. So we will see one by one. The first one is a slide or tile method. So we will see what are the requirements for the test. We need glass slide or a white tile, red cells, which is also called as a sample of a patient or a donor. Next is the antisera, next is the applicator sticks to stir the agglutination or to see the agglutination. So here we can see in the picture, these are the antiseras present. We have anti-A, anti-B and anti-D antisera. For ABO blood grouping system, we need anti-A and anti-B antisera, and anti-D is used for the RH typing. So let's move on to the procedure. So how we do the ABO grouping using slide or a tile. So we have to label the slide or a tile and we have to prepare 30 to 40% of cell suspension using a patient's blood, and we have to add 1 drop of 30 to 40% of red cell suspension into the slide or a slide, and we have to add antisera to that respectively. So after that we have to mix the reaction and look for an agglutination. So depends upon the agglutination we can report the grouping. So here we can see the interpretation of the test. If there is an agglutination which is present in the anti-A, it is called as a group A, and if there is an agglutination present in the anti-B, then that is called as a group B. If there is no agglutination in both the slide, then it is called as a group O. If you see any agglutination in the both anti-A and anti-B, it is called as a group AB. So we will see what are the advantages and disadvantages of the slide and slide methods. So it is used mainly in the outdoor camps, since it is very easy to do and it is a very quick procedure and the minimal requirements. So it is also called as a preliminary typing test. And what are the disadvantages? So it is not used routinely and it is less sensitive because we cannot centrifuge it or incubate it, and since we are using it in a slide or a tile, we cannot keep it for longer time and this agglutination gets dried fast, so which may give false positive result. Next, see the tube method. So as the name suggests, we are using test tube for the test, and it is mainly a recommended method used in all the labs. So it allows a longer incubation of antigen and antibody mixture without drying. So since we are using test tubes, we can centrifuge it and also we can incubate it. So tubes can be centrifuged to enhance the reaction, can also use to detect the weaker antigens or the antibodies. So we can use the cells to wash also. So washing with the saline helps to solve the problems in the blood grouping system which caused due to the excess antibodies. So in tube methods we can do two techniques, immediate spin techniques and saline room temperature techniques. Using this we can do both forward and reverse grouping. So what are the methods, how we use it? So in immediate spin techniques we do not centrifuge it or we do not keeping for a longer period, means we cannot incubate it. So in saline room temperature we are keeping it for incubation for 45 to 60 minutes. That is the main difference between immediate spin techniques and saline room temperature techniques. So in that forward grouping we use patient red cell suspensions. So for that we have to prepare 5% red cell suspension and we have to label the tubes as A and B. So to that we have to add anti-sera, which is anti-A and anti-B, to two different tubes, and after that we have to add a 5% cell suspension. We have to mix it properly and we have to centrifuge it. So we have to centrifuge it immediately for the immediate spin techniques, and we have to keep it for a longer period of incubation for room temperature, saline room temperature technique. Then after that we have to look for an agglutination. Okay. So after the agglutination we have to report it. If it is negative, then you have to confirm it with microscopically. So you can use a microscope to detect the clumps whether there is an agglutination or not. So this is the interpretation and the grading of the forward grouping. Okay, so in the A tube we can see there is agglutination in the anti-A, so it is called as the IA group, and if there is an agglutination in the B, then it is B group. If there is agglutination in the both A and B tubes, then it is AB. If there is no agglutination in both the tubes, it is O. So depends upon the reaction or the agglutination present, we can also grade it as a O4+, 3+, 2+, 1+ respectively. So in next is the reverse grouping. So in reverse grouping we are using patient's serum or plasma. So you have to prep for this, we need a pooled cell. We have to prepare a pooled cell of 5% cell suspension, label the tubes as A and B, and we have to add 2 drops of serum to each tubes. After that you have to add a cell suspension to the tube A and B. Then you have to mix it properly, have to centrifuge at 1000 RPM for 1 minute. Okay. For room temperature techniques, you have to keep it for longer period for incubation, minimum for 45 to 60 minutes. After that, you have to centrifuge it and look for the agglutination, and depends upon the agglutination, you have to report. So in reverse grouping, if there is no agglutination in the AB tube, it is AB. If there is agglutination in the A, then it is B group. If there is agglutination in the B tube, then it is a group. If there is agglutination in the both A and B tube, it is called as a O group. So next, third method is a microplate method. So here in this method we are using a microplate which is similar to the ELISA plate. It has a 96 wells and it comes in a different shapes. So it has either U and V shape. So it is usually used for the large sample, large volume sample. So that is the main advantage of this techniques, where you can use many samples at once. Next method is a microtyping method. So the principle of microtyping method is you have to use a microtube which is attached with the buffer dextran gel and it also has a anti-sera in it. So you only have to add the serum or a red cell into that gel card. So microtubes in this form of the gel card will be filled with the buffered dextran gel and it is impregnated with the anti-sera. So when you centrifuge it, negative reactions will come down and if it is positive, it will settle top. So depend upon that you have to report it. So moving on to the method, you have to use 10%, 10 microliter of the cell suspension to the microtube and you have to incubate it at 37 degrees Celsius for 15 minutes and have to centrifuge it. So moving on to the interpretation. So if it is negative or there is no clumps or agglutination, so the red cells will go and settle down. If it is positive or any agglutination is seen, so this agglutination will be trapped on the top of the gel card. You can see the reaction on the top of the gel card and depends upon the reactivity you can grade it 4+, 3+, 2+ and 1+. So here you can see the picture of incubator and the centrifuge which is used for the gel card technique. So what is the advantage? It is mainly very simple and very safe procedure to use and it has a greater sensitivity and the technical errors are eliminated as we no need to add any anti-sera. We just have to add a microliter of sample, either serum, plasma or a red cell. So let's summarize this topic. The Landsteiner described ABO blood group system in the year 1900 and later ABO was described by his associates. So it is basically depends upon the Landsteiner's law where it states that individual who lacks the antigens of ABO system will have a corresponding antibody in their serum. So we have mainly two types. We have forward grouping and reverse grouping. The methods used for the blood groupings are slide method, tube method, microplate method, microtyping method, automated or semi-automated method. So this slide method we are using slide or a tag, in tube method we are using the test tubes, microplate method the ELISA plates used and the microtyping method we are using a gel card where automated and semi-automated versions also can be used to do the ABO blood grouping system. So these are my reference in a Vancouver style. Thank you.